I'm Matt Fitzgerald, and I'm the Chief of Audiology here at Stanford. I think one of the exciting parts about being part of SICHL is we get a chance to see all these amazing technologies that I think have the chance to really fundamentally transform how we diagnose and manage hearing loss in humans. So I come at this from a slightly different perspective because I want to make sure we have the right tools to assess their efficacy. So for example, if you take the top concern of individuals with hearing loss, it's understanding speech and noise. But if we actually measure this in thousands of individuals, what you can find is you can have individuals with the same moderate hearing loss, some of whom still do quite well in background noise, and some of whom really can't function at all. Why is that the case? What's different between these individuals? Why do some perform so much better than others? So that's really at the heart of what we're trying to do. And I like to say a big part of our mission is updating the audiology test battery for the next generation. Traditionally, when we look at the audiology test battery, we're looking at hearing thresholds. So what are the softest sounds you can hear, and how well can you understand speech in a quiet environment? And we use that successfully the past 75 years. We're trying to go beyond that to try to better characterize these new technologies that are coming and to better characterize patient performance. And we're looking at doing that through introducing measures of speech and noise and listening effort into the routine test battery. So can we better understand, for example, if you have individuals who are performing differently, maybe some of these individuals have some sort of a synaptopathy, lack of nerve fibers, maybe there's other types of distortion happening within the cochlea, or maybe these individuals have more central or cognitive functions. For example, we're very fond in the field of noting that the number one modifiable risk factor for cognitive decline as people get older is untreated hearing loss. But we don't know which individuals with hearing loss are likely to develop cognitive impairments. And we think we can get at some of this by getting it measured with a speech and noise listening effort. So in updating the test battery for the next generation, we're looking at approaching this from a few different perspectives. First, and most fundamental, we're translating new tools of speech and noise into everyday practice and giving audiologists the information they need to do that. And that's vital for data like this, which show that individuals can do just fine understanding speech and quiet, but still have significant problems understanding speech and noise. Once we translated these tools, we want to make sure they're accessible to everyone. So we've built a tool that will allow us to score any test of speech recognition in any language. So no matter where someone is in the world, what language they speak, we can accurately assess the performance in quiet or noise or anything. And we think we can also use this tool to get a measure of listening effort as well. So not just how well do you function with your hearing, but how hard do you have to work to get there. And finally, we're looking at new advances and tools in artificial intelligence to actually try to help with speech understanding and noise. Because if we can model the specific deficits that one person has versus someone else, that we can devise tailored specific treatments for that individual. And that's really the thrust of where we're going at this time, to update the test battery for the next generation so we can take advantage and really evaluate all these new tools effectively.